Okay, I'm back. I'm gonna try and do a get ready with me again. Let's see if we can do this. But I thought this time I would talk about my experience with methadone. Because I've tried, well, I guess I could just talk about all of those, like my experience with methadone, Suboxone, NA meetings, treatments, outpatient, all that kind of stuff, because that's more of the stuff that I've experienced all of it. And for me, I feel like I found what has worked for me. And I think sharing my experiences with everything might be helpful for other people. So yeah. Okay, so first, methadone, which is what I want to talk about first, is something that I was on for quite a while. I was on, let's see, 2014, 15. I wasn't on it, like, consistently. You know what I mean? I wasn't on it, like, that whole time without any breaks, but I was on it for quite a while. So when I first was on methadone, I started because okay, so this is kind of hard to talk about, and I bet people will judge if they don't understand. But so if you are on opiates and you end up finding out you're pregnant, it's not safe to stop opiates while you're pregnant, because your chances of miscarrying are way higher because of the withdrawals that you would go through and that would put the baby through. So basically, if you go to any doctor will tell you that you need to be on some sort of opiate replacement therapy, because you're pregnant, your body is dependent on the opiates, and the baby, if the baby was put through withdrawals while in utero, then it has a lot of effects on the baby. So when I was pregnant, found out I was pregnant, I ended up going to a treatment center for pregnant women here in Washington, and I was put on methadone. And when I got to the treatment center and was put on methadone, very quickly I found out that you actually end up feeling high from that methadone. And so as an addict, I wanted more and more and more of what I thought or was told was safe for the baby. So I ended up purposely making my dose go way high up there. I ended up on 135 milligrams of methadone. And, my doctor was, recommended that, basically when you're in this treatment center for pregnant women, when you start on that dose, the doctor will keep asking you if you're comfortable yet. Are you comfortable yet? Like, are you feeling, because what they don't want is they don't want you feeling withdrawals, because if you feel withdrawals, then that means the baby's feeling withdrawals. And so I was, going up on my dose until I got to where I felt like I was comfortable, which, reflecting back on that, I probably didn't need that much. But regardless, I ended up on 135 milligrams of methadone. So, everything was fine when I was pregnant, everything was fine. And then when I had the baby, which was Kimani at the time, that's when I found out about, that there is a medical process for the baby to get the baby off of the methadone. So that was hard to witness and be a part of. But it was kind of frustrating because it's not like I had an option at that point. Or even when I was pregnant, there wasn't really an option to say like, oh, I don't want my baby on that, because medically there's really not any options if you're using, which is another, reason why you shouldn't use, because if you end up pregnant, then you're putting the baby through all of that. So Kimani ended up being healthy and fine. She went through her medical process at the hospital after she was born, and everything turned out fine. And then I was on that super high dose of methadone. And once I had her and I wasn't pregnant anymore, my body had to adjust to that high dose that I was on, because it was a high dose. So I remember the first couple of days after having the baby, I felt really out of it because, well, number one, I just had a baby, but number two, I was on this super high dose of methadone. And, one thing I can say is that your body adjusts to that dose that you're on. Like, for me, one of the side effects that I always noticed with methadone was that I was constantly sweating. Like, constantly sweating, pouring sweat. It wasn't like a normal amount of, it was not a normal amount of sweat. It was, like, ridiculous. Like, for not doing anything physically, to have that much sweat, it was just kind of crazy. So that was one thing. But one of the mental things that I noticed was that, see, I'm already diagnosed bipolar, so I have like a lot of up and down swings and a lot of manic episodes where I'm just like very go, 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 and then a lot of down times. And I noticed with the methadone that the swings were very intense, and a lot of the behaviors that I had when I was using were hard for me to let go when I was on methadone. Like, I almost felt like I was just high on a different drug. So for me, one thing that was really hard for me to stop was stealing from stores. That was super hard for me to stop, if I'm just being honest. I had, for so many years, survived like that and thought that, felt like that was how I met my needs, was to go steal in stores, that when I got sober, I couldn't wrap my head around stopping that. So yeah, I constantly put myself in risky situations by stealing from stores, even when I was sober, when I was on the methadone. Another thing that was challenging was really just like getting my life together in any normal type of way, like how I've been able to get my life together now, being sober, I never was doing when I was on methadone, because it almost felt like the people who I was surrounding myself with, like at the methadone clinic, everybody was either still doing drugs, because one of the other things with methadone is that it doesn't have any kind of blocker in it. Like, you can get high on methadone and not have, there's nothing that will happen to your body, basically. So yeah, that was challenging for me. It felt like the people I was around at the clinic didn't have like the most positive, lives. They didn't seem like they were like living the best lives. And I was always up at the clinic, because you have to go to the clinic every single day. And so yeah, there was that. Then another thing was weight gain, which especially now, that's not like a deal breaker for me, because weight is something that you know, it's not, I mean, it sucks, but it's not the biggest of deals for me. Like, I take plenty of medications that the side effect is that they make you gain weight. And while I was in treatment this time, I kind of like worked on that and figured out how to just accept weight gain, because, you know, that's one of the things that comes with getting sober is weight gain. So, you know, so anyways, there's that. You know, I feel like the other thing that happened for me, at least, was that, so eventually, I mean, at first I started out just on methadone and being sober, you know, just taking my dose as I was supposed to. Oh yeah, that's the other thing, is that sometimes, being on methadone felt like, for me, it felt like, I was just on a legal, like, it felt like heroin, but legal, almost. Like, it was just like I was just going to get well every morning or something. There was nothing in my mind that changed. It was like I was on drugs one day, and then the next day I was on methadone, but this is socially acceptable, if that makes any sense. I don't know if that makes sense. But, so, when it came time that I started, like, not wanting to be sober anymore, or I felt like I had these urges to use, there was, like, my mentality hadn't changed at all. There was really no reason at that point that I felt like I should stay sober. So the first thing I did, sorry, I have a hair on my face somewhere. First thing I did was I started dabbling with weed. And some people, you know, this is like a controversial topic for, I feel like, for a lot of people in recovery, because some people think that weed is okay, other people think it's not. I don't really care what other people think. For me, weed is not an option. It's just not. And I wish it was. Sometimes I wish it was. But it's just not, because I've tried every way possible to cut corners and to do it my way, or, you know, try a different way, and they all end up the same. I end up eventually getting high the way I like to get high, and that's, you know, that's what I don't want. So if smoking weed means eventually I'm going to end up where I don't want to be, I'll just not smoke weed. It's not that important to me. It's not that, to risk it all for some weed doesn't make sense. You know, and it's the same with alcohol. You know, but for other people, you know, if that is how you want to do it, then so be it. But I'm just speaking from my own experience that it all leads back. It does. And this isn't the first time I've tried to get sober. This isn't the second, third, fourth, fifth, sixth, seventh, or eighth time I've tried to get sober. So, it is what it is. And that was like one of the things I just had to accept. And, you know, trust me when I say I've tried. I've tried to just drink. I've tried to just smoke weed. I've tried to just do this, just do that. Only on the weekends. All of that, all of those, like, they just never work. So, you know, my favorite counselor, again, who I talked about in my last video, she's the one who kind of, like, helped me drill that into my head. Like, you know, you've tried every way, haven't you? And I have. So, anyways, so yeah, so what happened with methadone was that I tried to just start smoking weed. And when I just started smoking weed, then eventually, it for me at least, it like lets my guard down to think like, okay, I can, because most of the addicts that I know, we think, I'm just going to do it this one time, and then I'll go back to being sober. Like, I'm just going to get high this one time, and then I'll go back to my life. And it never works out like that. And so, yeah, I thought, I'm just going to get high. I'm just going to smoke weed. And that's it. And I'm not going to do anything else. And I'm going to stay sober. And then, sure enough, you know, it was like a couple weeks that I was just smoking weed. And then it's like your guard is down. It's like when you start smoking weed, just smoking weed, then your guard is down and you think, oh, look, I'm just smoking weed. You see how successful I am? My life hasn't fell apart. I'm not doing anything crazy. Like, I can just do this now. And it's really just your addict in your mind telling you this so that you can get high. That's really what works out in the end. So yeah, eventually, you know, I started smoking weed. I was still on the methadone. And then, you know, a common thing up at the methadone clinic, at least from what I've experienced, is that methadone takes care of the opiate problem in your life. But if you're somebody like me who had used opiates and amphetamines, or if you're somebody who uses uppers and downers, the methadone is helping the downers in your life, but there's nothing for the uppers in your life. So a lot of people will just use methadone so that they aren't physically dependent on heroin. They'll use methadone so that they aren't sick anymore, but then they'll continue to use meth or whatever the upper is that they use. So I ended up doing that, and I was using the methadone like I was supposed to. I was smoking weed because that wasn't affecting me, and then I started using meth again, which also urged on my need to steal. And so then I was just in this repetitive daily go to the methadone clinic, go steal to then get stuff for meth, and then you know, go home and then repeat. And so, you know, but when you're doing all of that, it eventually, you know, because I was using, you know, at that point you're not clean anymore if you're doing it like that. And so then, you know, I started hanging out with more people who were using, and then eventually missed the clinic one day or didn't go get my dose one day. And so then, oh no, now I need to get heroin again. So, you know, slowly, all of a sudden, I was not going to the clinic more than I was going to the clinic, and then I was full-blown using again. And I've done that cycle with the methadone clinic quite a few times. And it's the same thing for me every time. So this time when I was trying to get sober, and I had a choice or an option to get back on methadone, to make this makes sense, methadone is a legal drug that helps people stay sober, but you also end up feeling high when you're on it. So I say that to say, when I was going through detox to get sober and I had an option to get on methadone, the addict in my mind was telling me, get on methadone, because I knew I would feel good immediately. I would feel high immediately, and that's the only way you can legally get high, or get high without the stigma of getting high. And but I really wanted to stay sober. Like, I didn't know if I was going to stay sober forever, but I knew I really wanted to try. I knew I wanted to try this time, and sorry, my nose ring. I knew I wanted to try this time, and I didn't want to fail. And so I was like, you know what? I've got to try something different. Like, I can't do the methadone thing again. It's not going to work. I know it's not going to work. It may work for some people, but it never works for me. So this time I decided I was going to get on Suboxone and try that. So, you know, I was going to talk about Suboxone in this one, but this video has gone on for quite a while, so I think I'm going to do Suboxone in the next video. And maybe I'll finish my makeup in the next video too, since all I've done. I did one get ready with me, put no makeup on. Second get ready with me, foundation, concealer, powder. So I'm gonna shoot for bronzer, eyeshadow. Maybe I can do the whole face next time. We'll see. But anyways, thanks for watching. See you in the next one.